Hello, my name is Brielle Kroom. I'm a junior at Miami University, and today I'm here to speak to you about mental health. Over the years, the prevalence of mental health diseases and concerns have grown far too loud to ignore. It is estimated that more than 1 in 5 U.S. adults live with a mental illness. In 2022 alone, this meant that 59.3 million Americans were living with a mental illness, or 23.1% of the adult population. The services that are offered can vary in effectiveness and quality, and the list of factors contributing to mental health problems can make obtaining these services even harder. To identify solutions, we must first identify the problems. I could talk about the list of problems in the mental health care system, but the range of them is remarkably wide. It would make it harder to identify specific problems, direct correlations, and possible solutions. My hope in presenting this information is that either you, individuals affected by mental illness, who may be able to identify with some of the information I'll present, or the local government policymakers and community advocates who may recognize the small steps it takes to make large progress. As I've already identified, 59.3 million Americans are living with a mental illness, and yet stigma is still one of the biggest personal barriers to taking the leap and receiving mental health care. According to a study completed by Namki Choi, Brian Choi, and C. Nathan Marty, research has shown that about one half of U.S. adults with past year suicidal ideation, plans, or attempts reported contact with any type of mental health services. This means that the other half made no contact with mental health services. The question is why? Many sources feed the perpetuation of stigma. Men, for example, fear stigma in their places of employment, from their loved ones, and even those other than loved ones. They can be driven by self-reliance beliefs, which aren't necessarily a bad thing, but we'll touch more on that later. In the same study I referenced earlier, the participants were asked to identify their reasons for not receiving treatment despite the perceived need for it. 50.6% stated the cost of treatment or the lack of insurance. 40.4% stated the concerns of stigma, and 36.3% stated that they didn't think the treatment was necessary or would work for them. There were also many other reasons. As if the weight of facing stigma from external sources wasn't enough, the internalization of stigma can be extremely damaging. This frame of mind creates another hindrance in reaching out for help, helping reinforce the discomfort and shame it wants. Self-stigma will limit your understanding and awareness. And if intervention doesn't occur, the situation only gets more critical. It can make you believe the stereotypes of those with mental illnesses, feel treated as inferior or not taken seriously, and self-sabotage and rumination are just around the corner. It is vital that you remember you are not alone. It feels weird to even say this, but if we have COVID to thank for anything, it allowed for opposition in the mental health stigma storyline. It was during this time when all of us, unwillingly but necessarily, experienced extended periods of social isolation, loneliness, and uncertainty that the discussion of depression, anxiety, and other mental health issues became more open and ordinary. Here's a small clip of some TikTok videos discussing various things regarding mental illness.
Please remain on the line. Para español, oprime el número 2.
Don't text your depressed friends how you feeling today. they don't know what to say. They feel awful, and then there's like this guilt of like still bad.
4th of July. Well, you do enough talk, my little hawk. Why do you cry? Tell me, what did you learn from the Tillamook burn or the 4th of July? We're all gonna die.
my gosh, guys, I think my mental health is not too bad today. I'm actually having a pretty decent day.
I think one of the biggest misconceptions about depression is that if you're depressed, you're just going to feel sad all the time. And that couldn't be further from the truth.
A distant relative of stigma is called self-reliance. Certain levels of self-reliance are good. It can help you become more independent and build more confidence. However, too much self-reliance can turn you against seeking help. More frequently seen in the rural United States, the fostering of the value of self-sufficiency has been passed down through generations. Emily Keller and Gina Owens conducted a study that recognized the general idea of self-reliance as a barrier to treatment seeking in rural populations, and that undergraduate and graduate men felt that this idea was an expected masculine social norm, and in turn created negative attitudes towards seeking help. 80% of rural older adults pinpointed the personal belief that they wouldn't benefit or shouldn't need the help of a mental health care professional as a barrier to treatment seeking. While conducting these studies, these women found a few reoccurring themes in the responses they received that I think are important to note. Many concerns of their participants involved the accessibility and availability of treatment providers. For example, the lack of providers in local areas was a common complaint, and many participants discussed driving long distances to see counselors. Cost and insurance were among other frequently identified barriers. All of this data emphasizes the necessity to address the barriers of self-reliance and stigma on a therapeutic level, a community level, and through intervention when necessary. Building community within your area is vital. It allows your neighbors, friends, and acquaintances to know that they are not alone and have somewhere to turn. Building a community can also be the cause of a necessary change. And since we're already on the topic of communities, let's discuss another cause to these deficits of care affecting many communities around the United States: food insecurity. There are many factors that can cause food insecurity, such as living in poverty, high prices of nutritious, healthy foods, the lack of employment, and much more. The concept of food insecurity does not discriminate against any specific community, and it can happen to anyone. However, certain marginalized groups of people who are food insecure have less opportunity to access help to get out of it. The LGBTQ community is one of those marginalized groups. The relationship between food insecurity and mental health effects is documented for the LGB community, and those adults who reported low food security also reported lower life satisfaction when compared to other LGB adults who were food secure. The video I'm going to show you will offer quite a few small ideas and tips to create accessible food options. You will see an interview with Laura Choate, a food pantry director from Oklahoma City, and Emily Engelhard, the Feeding America Vice President of Research, who both offer useful information and personal experience to extend the conversation about combating food insecurity.
Be a big order.
Laura Choate has been the food pantry director at Church of the Open Arms in Oklahoma City for 15 years.
When they get the box and say, wow, this is a lot, it feeds my soul.
Working at the food pantry is deeply personal for Laura, who at only 11 years old was homeless and hungry herself.
I lived downtown and slept in garbage cans and ate out of garbage cans.
Data collected by the U.S. Census Bureau found that food insufficiency was over 1.5 times more common among members of the LGBTQ community than non-LGBTQ people. Laura is a lesbian and has noticed the disparity. She says her food pantry is a place where all people can find acceptance.
Nobody bats an eye if they come in a wig or whatever.
The food pantry at Church of the Open Arms is one of 200 that's part of the Feeding America organization.
Our goal is to address food insecurity, including for people who are the most vulnerable.
Feeding America Vice President of Research, Emily Engelhard, says there are ways you can take action.
Volunteering is always a huge thing that you can do for the pantries in your community. And then when volunteering, practicing affirming approaches to the people that we're interacting with. So not assuming pronouns, wearing a rainbow flag.
Another way to help is to advocate. SNAP, formerly the food stamp program, is the first line of defense against hunger.
And so continuing to push for our local governments, our state governments, to expand access to SNAP is one of the most sort of broad impact things that people can do.
Rena Roy, ABC News, New York.
A study conducted by Dicky Barua, Rainier Massa, Don Operario, and Sylvia Shangani offered compelling information regarding the numerous effects of food insecurity on the LGBT community, including a captivating connection to the highly recognized Maslow's hierarchy of needs. Maslow's hierarchy of needs argues that in order for someone to give attention to a higher order need, like their health, their psychological needs, like food, must be satisfied. There is also a noted correlation between food insecurity and medication non-adherence, which consists of skipping medication doses, taking less doses of the medication to save them, a delay in filling or refilling a prescription, or even going without it altogether. All of these medication non-adherence behaviors were documented in the same study as a direct cause of financial instability, a shared cause of food instability. It is important for communities to offer their residents adequate access to food, whether that be through public or private food pantries, and provide education that counteracts the negative stance that comes with accessing food pantries. Access to these programs can negate stigma or negative feelings surrounding the use of food pantries, and also hopefully reduce the rate of stealing food at grocery stores and other places alike. Patience Afulani, Alicia Coleman-Jensen, and Dina Herman conducted a study in which the demographic focus extended among various age groups, marital statuses, family types and sizes, races, and ethnicities, all within the United States. In addition to food insecurity playing a part in the neglect of mental health care, their study showed connections to poor management of chronic conditions such as diabetes. It can also be associated with high-risk behaviors like smoking cigarettes or other sources of nicotine use, alcohol use, and substance abuse. Numerous studies have revealed that individuals experiencing food insecurity have greater rates of hospitalizations and emergency room visits, possibly as a result of utilizing preventative services less frequently. Amongst the other data these women collected for their study, they found that none of the interactions between food insecurity and gender, chronic disease, and health insurance status were significantly different. These results imply that there may not be a significant difference in the relationship between food insecurity and severe mental illness between men and women, and those with or without chronic illnesses, or those with full or partial or no insurance coverage at all. These findings only further emphasize the fact that mental illness is not selective, and anyone can battle these issues. That's why it's important to offer education and access to everyone. The necessity for further studies that examine the relationship between food insecurity and mental health should also implement research on the effectiveness of the integration of programs that address both problems. These programs, such as food pantries, can present as a contact point for identifying adults who could be experiencing mental health problems. And because traditional counseling services may not be available to all, it is vital to provide some sort of counsel to your community. Providing information and access to programs that can help combat food insecurity, such as WIC, which provides low-income women, infants, and children up to the age of 5 with nutritious foods, further information on healthy eating and diets, and even referrals to healthcare providers. Websites like feedingamerica.org can help anyone search for local food banks within their network, and even just a simple Google search of Butler County food pantries took me to quite a few links that provided well put together lists of food pantries in my area. Even though providing this information may seem like such a small task, the gift of knowledge and the effect of the openness of the conversation can create a ripple effect in reversing both of these problems. Another large leading factor in mental health diagnosis and their negative effects is poverty. A developed definition of poverty was originated by Steinringen, in which he states, poverty is an enforced lack of basic material power to live as one wants, or as reasoned fear that one might fall into that situation. It is to live under the dictatorship of material necessity without choice and control in one's daily life. That's what poverty is. It's about freedom and power and the lack thereof. There are several obstacles that keep individuals from seeking and receiving mental health treatment, including a variety of practical, social, and psychological barriers. Some of the practical barriers include the cost of treatment and the lack of insurance. Many mental health clinics' service hours do not accommodate workers in lower wage positions, those whose schedules are not flexible, or those who work double shifts. Many of these clinics also do not accommodate mothers, so a lack of childcare can also pose as a barrier to receiving this care. Additionally, women who live in poverty have often had negative experiences with authority figures, and the potential difference in social class between a patient and their therapist can raise questions for a patient as to whether or not their therapist can truly understand or sympathize with their situations. Poverty is a wide-scale issue in the United States, and tackling it head-on can be understandably daunting and stress-inducing. However, there are once again quite a few small steps that can be taken to lessen the effect that poverty can have on one's mental health. A collection of studies have collected data and demonstrated positive outcomes for mental health interventions in communities affected by poverty once they were developed and reworked to specifically address the proper contextual stressors in their lives. The finding of these studies may suggest that if intervention is modified, mental health services could serve the poor community's needs and allow clinicians in these fields to better service some of the most vulnerable families in the United States. More often than not, the reason that therapists are trying to avoid the conversation surrounding the lifestyle and hardships of their low-income clients is because of their own discomfort with the subject and the lack of knowledge and training. This calls for a need to build upon existing models of multiculturally competent therapy, which in turn will create a development of class competence among providers. The purpose of the development of this skill is to increase levels of self-awareness related to their own social class, awareness of their assumptions about poverty, social class, and therapy, knowledge of poverty's psychosocial impact, and knowledge of effective interventions for addressing the negative psychosocial consequences of poverty. In addition to boosting the effectiveness and knowledge of your community's providers, it has also been proven beneficial and useful when communities enhance their outreach options, including transportation to and from therapy, home visits for those who, for whatever reason, can't leave their homes, affordable childcare options, and flexible scheduling. Further access can provide case management that can assess a client's external stressors and instrumental needs, and in turn, develop interventions to address them. There are so many barriers facing the access to mental health services and care. It can be overwhelming when you sit down and really look into all of the different components causing these issues. The unfortunate reality is that mental health isn't going away, and it has only become more debilitating and impactful to people's lives. These issues can no longer be ignored or pushed aside. If you plan to leave this presentation with only one piece of information, here's your piece. When a small group, like your town or community, enacts a change, this causes other small groups to see the benefits of that change and enact them themselves. Eventually, these small-scale changes can create a national impact. It's a hard task to change a nation's way of thinking, but focusing on your community's way of thinking can create a pathway to hopeful followers. Thank you.